Hello, and welcome to the County Health Rankings and Roadmaps 101 webinar with a tour of our website. My name is Stephanie Johnson, and I'm a community coach with the County Health Rankings and Roadmaps, and I'm joined by my colleague, Karen Odegaard.
Hello, I will be helping to answer questions today and then also chatting out some links to you that you may find of interest as we go through today's webinar.
First, we'd like to acknowledge the important relationship we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. Thanks to the support of the Robert Wood Johnson Foundation, we currently have 3 community coaches in the County Health Rankings and Roadmaps program, and their assistance is available to you at no cost. Please don't hesitate to contact us if you need assistance with a tool, a question, or figuring out the next step in your process. You'll find this orange box throughout the website, so you can send us an email. This program is the result of the contributions of many partners, including those listed here. And we want to take a moment to get you oriented to the technology we're using today. The GoToWebinar attendee interface is made up of 2 parts. On the left, you can see the viewer window, where you will see my screen throughout the presentation. And on the right, you can see the control panel, which is where you can interact with us. Because of the number of people we have on today's webinar, we'll be taking questions via the control panel. Feel free to enter your questions in the control panel at any time, and as questions pertain to the content we're covering, we'll pause and answer them along the way. We'll address questions outside of what we cover during the Q&A at the end of the webinar. So again, feel free to enter comments as well as we go along. As we go through the webinar, if you have an idea or a thought, maybe a tool or an example to share, please feel free to enter these in the chat box, and we'll make every effort to share them with everyone on the call. We'd like you to specifically think about, or encourage you to think about these questions, reflection questions. Who else do you need to share this information with? What's one idea for action that you plan on taking from this webinar? And what else do you need to know to take action or use this information? Here's a look at what we're going to talk about today. We'll start first with an overview of the County Health Rankings and Roadmaps program, and then we'll demonstrate how you can use our site to explore the rankings data. We'll also talk about tools for taking action and take a look at how the Roadmaps Action Center can help you move forward with action, and also how you can learn from others. Throughout the webinar, we'll head over to the countyhealthrankings.org to see how the site functions, so you can walk away from today's webinar able to confidently navigate the site. This year, the Robert Wood Johnson Foundation laid out a powerful vision for building a culture of health in every community in the country. That vision includes the belief that all individuals and families should have the means and the opportunity to make choices that lead to healthy lifestyles, regardless of where they live. So we'll start this webinar with an essential question, something you can hold in your mind. How can County Health Rankings and Roadmaps help build a culture of health in every community? This image comes from Cambridge, Massachusetts. They had all of their community partners put their names on a strip of fabric, and then they weave them together into a tapestry. I really like this image because it visually represents the power of collaboration to bring diverse partners together to create something new, a partnership. Working with diverse partners from all walks of life. And this is one of the ways that Cambridge is building a culture of health. So we'd like you to think about, what does your tapestry look like, and is it helping you build a culture of health? Similarly, the County Health Rankings and Roadmaps program is made up of many components that work together with a common purpose to build a culture of health county by county. And as we share the various components that make up the County Health Rankings and Roadmaps, think about which piece or pieces of the program you can use. So let's start by reviewing a little about the County Health Rankings. First, why do we rank counties? Well, the rankings take several different pieces of data and simplify them. They give communities a quick and easy snapshot of their health and the many factors that impact how well and how long people live. The rankings also serve as a hook and generate media coverage. And this is good because it helps people understand the health status of their community. It also provides an opportunity for people to tell the story of the many factors affecting health in a community. Rankings also add context. A number by itself doesn't tell us much. The rankings allow communities to compare themselves with others within their state, and they can also compare to top U.S. performers on individual measures. Rankings are a call to action. They provide an opportunity to ignite discussion and action at the local level with many diverse members of community from multiple sectors. And we really believe that the county health rankings are a starting point for discussion in communities, not an ending point. Communities will want to dig into local data to further understand what's going on in order to know where and how to take action. This picture shows us the thinking behind the rankings about how rankings can be a catalyst for action that improves the health of everyone in a community. We start with population-based data from a variety of sources, and then we use that data to rank the health of nearly every county in every state. Each year, the rankings release generates a lot of national, regional, and even local media attention. And some of you may have read or maybe you've even been quoted in stories about how your county compares to others in your state. Community leaders use the rankings release to get the word out to their community and local media, and they use the findings as an opportunity to mobilize multiple sectors to look further at their community's strengths and needs. Based on a deeper look at their unique priorities, community members identify evidence-informed strategies that can be implemented locally. And over time, these evidence-informed strategies ultimately result in longer, higher quality lives for all the children and adults in the community. So essentially, the county health rankings aren't about numbers. They're really about a call to action. The horizontal portion of the model underpins the rankings. The county health rankings show us that where we live matters to our health and that a broad range of factors impact how long and how well we live. The vertical portion of our model underpins the roadmaps. The roadmaps offers communities guidance, tools and resources to move from awareness to action to create healthier places to live, learn, work, and play. So we're going to start with the rankings. The County Health Rankings ranks the health of nearly every county in every state. And for each county, you will find two rankings, one for health outcomes and one for health factors. There really are two separate messages to convey: how healthy a county currently is, health outcomes, and we color that green, and we call this rank today's health, and how healthy a county might be in the future based on the many factors that influence health. Health factors you see in blue, and we call this rank tomorrow's health. This image is really one of the most important images that we're going to share with you today because it shows what we use to determine the county health rankings and what influences health in a community. So this model shows the relationship between policy, health factors and health outcomes. It illustrates how multiple factors impact how well and how long we live. Things like how we commute to work, housing conditions, access to parks and the quality of our schools, availability of jobs, access to healthy foods and clean air and water, and our social connectedness all impact our health outcomes. So starting from the bottom, we know from the research that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. Many health factors, those that you see in the blue boxes, shape our community's health outcomes. We specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. We measure two types of health outcomes, what you see in the green boxes, to show how healthy each county is, length of life and quality of life. So as an example, a complete streets policy aimed at improving the way streets are designed to encourage walking and biking can influence health factors such as transit, diet, and exercise, which in turn influences health outcomes. Because much of what affects our health happens beyond medical care or outside the doctor's office, this image and the rankings that are based on it underscore how important it is to build a culture of health where getting healthy, staying healthy, and making sure our kids grow up healthy are top priorities. So, having looked at many factors that make up health, let's take a look at how measures are selected. Well, we want communities to take action, so we use measures that reflect aspects of a community that can be improved. Valid, reliable, and recognized measures are used by other national measurement or rankings projects. For example, many of our measures are used in America's Health Rankings, which annually measures the health of states. We select measures that must be available at the county level for every county and every state. And the data we use must be available at low cost or free and as up-to-date as possible. We also use fewer measures. 34 measures were used in 2014 because the rankings are meant to be a snapshot. Again, the data is a starting point for communities. So, having looked at the model and measures, now we're going to turn our attention to the website. I'm going to take you to the countyhealthrankings.org website, and the first segment of our web tour will focus on introducing you to some key navigation tips and exploring the rankings data. So at the top of our landing page, you'll see an orange navigation bar. And this orange navigation bar remains at the top of your page throughout the site. It's really a great way to navigate around the full site with just a few clicks from this orange navigation bar. No matter where you are on the website, you can always scroll up and click on the County Health Rankings and Roadmaps logo to get you back to the home page. Using the Rankings menu, you can access information about our approach, the rankings data and methods, as well as tools to help you understand and use your data. You can also search here for your state or county. Using the Roadmaps menu, you can access tools to help you take action and learn from others. Other items on this navigation bar include tools and resources, and you'll find a variety of tools and resources here, from rankings documentation to Action Center tools to a Rankings and Roadmaps presentation that you can download and use in your community. You can find upcoming and archived webinars here, and you can also check out our county by county blog, search the site, learn more about the program, and find frequently asked questions. This year, we celebrated 5 years of county health rankings. You can click on Learn More and look back at where we've been, read more about what's new this year, and look forward to all that is to come here on our Celebrating 5 Years page. Scrolling down, you'll see a progression of tabs that can help you think about how you can use countyhealthrankings.org to explore your rankings data, move forward with action, and see and share results. Next, you'll find a map of the United States and a search where you can enter your county or state name. And we'll click on the map to begin to explore the rankings. And I'm going to click on New York. When you click on your state, you come to a state overview page that shows both your health outcomes map in green and your health factors map in blue. From this page, you can download data, find more data, and browse through community health improvement resources, all specific to your state. You can find stories from your state and your state contact. From here, you can also link to the Action Center, and we'll talk more about this in a bit. From your state page, you can either select your county from the drop-down menu back at the top, or click on your county on the map. So I'm going to click on Madison County, and we'll enter into the Madison County, New York snapshot. So here we are on the county snapshot page, and you'll notice that we've progressed to the second tab up at the top. These tabs offer another way to explore your data. You can use these tabs to explore the measures, get to downloads for your state, and compare multiple counties within your state. So let's walk through a little bit of what you'll find on your county snapshot. In the first column, you'll find measures, and we have 34 measures. There are 2 overall ranks, health outcomes. You'll notice that's in green, picture of today's health. And health factors, again in blue, just like the model, a picture of tomorrow's health. You'll also find ranks for each health outcome. We've got length of life and quality of life and health factor in this far column. So I'll scroll down so you can see the ranks for the other health factors. Your snapshot contains 4 columns of data. The first column you'll find is your county data. And here we see data specific to Madison County, New York. Next, we've included trend graphs for 12 measures where sufficient trend data is available. You can see a detailed graph of the trend data by clicking on the graph icons. And we've color-coded each icon to help you quickly see whether your county's estimate is increasing, decreasing, or staying the same over time. So a red graph icon would indicate your county is getting worse for this measure. Yellow indicates your county is staying the same for this measure. And green indicates your county is getting better for this measure. So let's take a look at the trend graph for adult obesity in Madison County, New York. And you'll see that your county's trend is in orange, the state trend is in green, and the national trend is in blue. Continuing on, the next column you'll see is the error margin. We use a 95% confidence interval, which basically means that we are 95% sure that the actual number for your county is in the given range. In the fourth column, you'll find top U.S. performers. What this means is that only 10% of counties have a better value than what is listed in your county snapshot. So this is meant to be included as an aspirational value, something to reach for. And finally, you'll see your state column, and this allows you to compare your county's number to your state overall. Up above is areas to explore, and this highlights potential challenges a community may want to examine more closely. When you turn this feature on, orange boxes will highlight areas to explore based on health factor measures that seem to have the greatest opportunity for improvement. Your county snapshot also includes additional measures, which may provide some additional data that might be helpful to you, but is not used to calculate the rankings.
Steph, this is Karen. I wanted to jump in here with a question that we had from an audience member. So somebody is commenting that their state has some data that they think might be valuable to add to these additional measures. Can folks work with the County Health Rankings and Roadmaps program to include that data in additional measures?
Thanks, Karen. That's a really great question, and the answer is yes. We encourage states to express their interest in including additional measures, and the best way to do that is to contact your state contact and express your interest. And as you might remember from the your state overview page, your state contact would be listed in the lower right-hand side of that page. So we're open to suggestions, and I think that's a great question. Thanks for bringing that up. Moving on, let's talk a little bit more about each of our measures. By clicking on the Measures tab, or you can click on the measure name from that snapshot. We looked at the adult obesity trend graph, and so let's take a further look at this measure. I'm going to click on the adult obesity measure, and this brings us to the measure detail page for adult obesity. Once again, you'll see that we've progressed along the tabs at the top, and now we have a new set of tabs specific to the measure detail page. From these tabs, you can look at the detailed data for this measure. You can see the full description, including why we use this measure. You can learn more about the data source, and maybe even begin to browse relevant evidence-informed policies and programs from What Works for Health. On the left, you'll see a brief description, a bit about the rankings methodology, and then summary information for this measure. You can also navigate to other measures from here as well using the orange box in the left corner. So we've also included some tools on our site to help you understand your rankings data and to think about how you can measure your community's progress over time. Returning to our orange navigation bar at the top, you can use the rankings menu to get to using the rankings data and measuring progress. So I'm going to click on measuring progress. And this is a tool that helps you understand how to use rankings measures, where to look for other data that can help you tell your community's story, and how to tell if your community is poised for progress. As you can see, countyhealthrankings.org offers a number of ways to explore your county's data as a starting point for change. And this brings us back to roadmaps, which offers communities resources to move from awareness to action. So let's go back to our slides and learn a little bit more about roadmaps. Going back to the thinking behind the rankings and roadmaps, roadmaps addresses the vertical section. Now that we have our community's attention, we want to find the best possible strategies to impact our community's health priorities. And this is where communities take action to improve health. But how do we do this? The Take Action cycle is the how within county health rankings and roadmaps. At its core are people working together to improve health in a community because we know solving issues like low high school graduation rates, excessive drinking, or poor health care requires the wisdom and resources of people from all walks of life. You'll see several sectors in the blue circles in the center of the cycle. Communities can improve health by using the steps of the cycle, assessing needs and resources, focusing on what's important, choosing effective policies and programs, and then acting on what's important, and being sure to evaluate those actions. Throughout this work, it's really important to continually communicate with partners and policymakers and your community, and to know how to use media effectively to tell your story. The action cycle is the action part of the program, offering communities guidance, tools, and resources to move from awareness to action. And there are 4 core principles that are at the heart of roadmaps. First, it takes everyone, all of us, working together to improve the health of a community. We need to move as quickly as possible from data to action and not get stuck in analysis paralysis or drowning in data. We encourage communities to look to the evidence to inform these actions, and if you innovate, make sure to evaluate. We encourage communities to keep focus across the health factors, including social and economic factors. And don't be afraid to take on policy, systems, and environmental change, which will create the greatest long-term change in health for the children and adults in your community. The Take Action cycle lays out a series of steps that communities can take to work together to build a culture of health. But this series of steps isn't always as clear and simple as they appear in this graphic. Making changes to improve health in communities is messy and complicated, and building relationships across sectors can be challenging. But we've designed a series of steps to help communities take the next step wherever they might be in the Take Action cycle. So let's go back to countyhealthrankings.org now and explore roadmaps. This part of our website tour will focus on tools for taking action and learning from others. So returning to the website, we're going to go again to the orange navigation bar at the top of the page, and we're going to click on the logo to take us back to the home page. Once again, we can get to the roadmaps resources in a couple of different ways. We can use the roadmaps menu on the navigation bar, or we can use the progression tabs in the center of the home page and click into Move Forward with Action. We're going to start in the Action Center. So the Action Center includes a guide for each step in the Take Action cycle. The guides describe the key activities within each step and provide suggested tools, resources, and additional reading. You can start at assess or enter the cycle at any step. Work together and communicate sit inside the cycle because they are needed throughout the cycle. And you may have noticed that this is an interactive page, so you can hover your mouse over each step in the Take Action cycle to see some of the questions that the guide addresses. And this allows you to understand the different steps before actually diving into the guides. So these are questions that might help you think about, is this the step in the cycle that I may want to dig a little deeper in, focus on what's important? Similarly, there is a guide for each of the different types of people in the blue bubbles. These guides provide information on the role that each can play in improving the health of communities, along with guidance on what they can do during each action step. So let's take a look at one of the guides, and I'm going to click on Work Together. Here you'll find a brief description of the step, a description of the purpose, and who to involve. You'll find some highlighted tools and materials on the right side, and the option to download this guide as a PDF. Scrolling down, you'll see that we've broken each step down into key activities, so you can find the most relevant guidance and tools for where you are in this step. When you find a key activity that is of interest, you can open it to read the guidance and explore links related to those tools. You'll also find community spotlights scattered throughout the Action Center and what works for health that provide examples of the programs, policies, and tools in action. Here we see an example community spotlight from the United Way of Greater Toledo that explains how they used 3 of the tools in this key activity. Let's take a look. Community spotlights are really intended to be quick examples that focus on the nuts and bolts of how work is done, key partners, and accomplishments. So I'm going to use the back arrow to get back to Work Together. And throughout the site, you'll find these orange boxes inviting you to contact our team for personalized free help. Clicking on the Get Help box will take you to an email form that gets to one of our 3 community coaches who, thanks to the support of the Robert Wood Johnson Foundation, can be in touch with you to help you think about what your next step is or which tools might help. Another key tool Roadmaps offers is What Works for Health. Let's go there using the Roadmaps menu on the navigation bar. What Works for Health provides communities with information to help select and implement evidence-informed policies, programs, and systems changes that will improve the variety of factors we know affect health. To learn more about strategies that could work in your community, select a health factor of interest, these light blue boxes on the right, or enter a keyword in the search box. You can also browse new policies and programs that have been recently added. This is a growing and changing resource, and we're always looking for new strategies to include. And you'll notice some new strategies were included earlier this month. On the model, let's take a look at the types of policies and programs we find under Income. That's one of the blue boxes in the social and economic factors. So click on Income and we find 13 results. From here, you can filter your search by approach or decision maker or evidence rating. Highest rated strategies, those rated scientifically supported, appear first. And evidence of effectiveness can mean different things to different people. Our approach to assessing evidence combines what we know from scientific study and the observations of unbiased experts. Each reviewed strategy is assigned an evidence rating based on the quantity, quality, and findings of relevant research. If you click on a strategy, and I'm going to select the Earned Income Tax Credit, you'll find the full entry for that policy or program, including the expected benefits, expected beneficial outcomes, evidence of effectiveness, impact on disparities, and implementation examples and resources when available. So this strategy also includes a community spotlight, which highlights how Kentucky Youth Advocates is working on a statewide earned income tax credit. You'll find community spotlights sprinkled throughout What Works for Health and the Action Center. And we encourage you to look for examples of how communities are using the strategies, tools, and key activities in their work. If you hover over the evidence rating thermometer, you can see our definitions for all 6 ratings. You can learn more about our ratings and message from the left navigation menu on the main What Works for Health page. And finally, we know that communities learn so much from each other's successes and challenges. Using the Roadmaps menu to learn from others, you can find inspiring stories from our Robert Wood Johnson Foundation Culture of Health Prize winners. And that illustrates a real commitment to building a culture of health for all residents. Our stories section highlights examples of communities taking steps to improve health from across the nation. And as part of the Roadmaps project, we have some great national partners that can help you engage other partners and leaders locally. You can learn more here about how United Way Worldwide, the National Business Coalition on Health, and the National Association of Counties are helping to bring the message of rankings and roadmaps to their local affiliates across the nation. So as you can see, Roadmaps provides step-by-step guides, tools, and resources to help communities move to action. And we'll return now to our slideshow. To return to these reflection questions that we began the webinar with. And we'd like you to think about how to use these questions to help you know how to take action. So as you're reflecting on these questions, Karen, are there some questions that we've had from participants that we can help answer?
Yeah, great. Thanks, Steph. So we do have a question about whether we have plans to revise the rankings.
Good question. Our rankings are released every year, usually at the end of March, and our health factors are updated on an annual basis. So in 2014, we actually did add new measures to the rankings. Examples of those new measures include housing, food environment, mental health, injury-related deaths. So as we learn more, new health factors may be added, But one thing we're really committed to keeping is keeping our outcomes measures consistent from year to year. So as you might remember, the outcome measures are the length of life and quality of life.
Great. We also have a question from Ryan wondering, on his snapshot he noticed that occasionally there isn't an error margin included on a measure, and he wondered what that meant. And basically what that means is that sometimes the data sources that we're working with to provide this data don't always provide us an error margin. So in cases where we don't have an error margin from the data source itself, then we don't include an error margin in the snapshot. So you may see that occasionally.
Good questions, Karen. Anything else that we can pull from the participants?
So the county health rankings don't look specifically at sub-county level data, and a question that we often get is, doesn't that then leave some disparities sort of covered up? Doesn't it mask some disparities that exist in communities? And I know that that's a common question that folks have, and it's one that we had from one of our registrants before the webinar started. Stephanie, can you just talk a little bit about that?
Sure, Karen. That's a good question. We don't provide sub-county data in the rankings themselves, but you can find some sub-county data on your state overview page under the section called More Data Resources. And we always encourage communities to look locally for data that may offer some more information on health disparities that are unique to your community. So again, finding more data resources on your state overview page is one place where you could find sub-county data if it's available. Other thoughts about that?
Nope, I think that's a great great place to look as you start to explore more data for your own community, looking to see what is available through that state overview page and going to that data that's available for your state. You can often find additional data. So this is a great comment from Faith, that she noticed some sections or some strategies in What Works for Health that were of interest, but that she also has some others that she would like to suggest to us. That's fantastic. We very much appreciate hearing from you about what strategies you're not seeing, what things that we should be looking at, what policies and program areas are of interest to you. So definitely feel free to contact us. Again, you can use that Contact Us button that you find throughout the website, and that's a great thing to share with us, to let us know what strategies in particular you're interested in seeing in What Works for Health. We really appreciate that feedback from our users.
Thanks, Karen. One question that I see relates to how current our data is that is reflected on the rankings website. And again, another great question. And the answer really depends on the measure. We use the most up-to-date data that's available to us. And the place where you can find the currency of the data would be found on the county overview page, and I'd be happy to show you how to get there now. Let's go back to the website, and we'll go back to Madison County, New York, following our example from earlier. One of the measures that we looked at was adult obesity. And Karen, help me out.
I love our measure detail pages because they provide so much information. So there's a couple ways that you can see this. So on the left side of the page, you can see there's ranking methodology. Where there's years of data used is the third line down. But another great way to see this is to click on the data source all the way a little further to the right on that progression of tabs there. You can see Stephanie just clicked on data, then there's a description, and then data source is that next tab over. And that is where you can find out even more about the source of data that we're using. So you can combine that years of data used, information on the ranking methodology on the left, but then also looking at the data source to learn even more about that, where that data is coming from. And you can see here, you can actually go right directly to the website to download that data yourself and to read more about the detailed methodology for that particular measure. So we try to be as transparent as we can be to let folks know exactly how it is that we're measuring and looking at this particular, at all of our measures that we include in the ranking. So that is a great question to think about. How current is the data? We always use the most current data available on all of our measures, but that the year that the data may come from does vary from measure to measure.
Thanks, Karen. Appreciate you jumping in there for me. Other questions okay. So appreciate all the great questions and the input. We'd like to let you know that we have upcoming and archived webinars that you can access through our website. And in fact, we have a webinar coming up on Tuesday, October 28th, that is focusing on how lasting change happens, moving from food pantries to policies. So if that is of interest to you, you can go on our website. Karen will be chatting out a link for you to that particular webinar. You can also learn more by signing up for our e-newsletter at chr@match.wisc.edu to subscribe. We also encourage you to use social media and stay in touch with us and communicate about the County Health Rankings and Roadmaps program. So you can follow us on Twitter or Facebook. And we'll end with this beautiful tapestry again and hope that you feel inspired to reach out to others and take your next step wherever you are in your journey to build a culture of health in your community. Again, thank you for joining us on this webinar, and we look forward to hearing from you in the future. Thanks so much.